morning. How are you?
I am just pretty well.
I really do love your hair that way.
Do you like it?
Yes, I do. I've always felt that medicine was a vocation, a calling. It's been an avenue to do the things that I thought were the goals in my life, and I'm pleased with it. As an aside to my medical career, I have had a very strong and exciting marriage to my wife, Abby. When I went into private practice, July 2nd, 1979, we had borrowed money from the bank, we had ordered instruments, we had rented space, and there were three of us, one employee, Abby and I, and we saw 3 patients that day. At the initial portion of the day, we promised each other that we wouldn't answer the phone on the first ring. We'd wait until it rang 3 times because we didn't want people to think we weren't busy. There was a pediatrician here in town named George Clock who would introduce you to the family by sending one of the children. But that introduction was, if you did well, of course, an introduction to the whole family. So pretty soon Grandma and Grandpa showed up, and Mom and Dad, and so it blossomed.
The thing that I always noticed about Dr. Crawford was the loyalty of his patients. That always intrigued me because you could just see it in the patients that would follow him for years and years and years. But I understand now because he was always there for them. He was, whether it was in the grocery store or whether it was calling him at home or seeing him in the office, he was always their doctor. I always admired him for that.
He's full of compassion. He's full of caring. He explains everything to you. He meets you where you're at. And he's so respectful of his patients. He's the most humble human being I've had the pleasure of meeting. And I can't think of enough adjectives to say about Dr. C. He's just a wonderful human being.
This practice gave me a very rewarding personal benefit, a blessing, so to speak. I think there was several years ago that we marked the fact that I had seen 4 generations of patients, and that I was continuing to see the younger patients. I am blessed with the compliments and the trust that these families have offered to me as a caregiver.
Well, before I came, Dr. Crawford actually worked with Pat Brookhauser here at Boys Town. So Pat Brookhauser had a relationship with Mike for many years. When it was at that point in Mike's career, when he wanted to find employment with somebody rather than private practice, we were thrilled because Mike was Council Bluffs ENT. If anybody needed ENT services in Council Bluffs, it was Dr. Crawford. That was the name. So for him to join us and bring his reputation and together with Boys Town, it was great for both of us.
Boys Town has been very kind to provide a site, a staff, and physicians that will be able to take over my care. I feel very strongly about the continuation of care for this community. They are my people. I want the best for them. Abby and I are still fairly mobile. Now we're hoping to take a little bit longer trips of 2 and 3 weeks, and that hopefully will happen over the next several years. I would like very much to be able to read and speak Italian, and I am proceeding through various avenues to try to learn that. I have a granddaughter who is the apple of my eye and is now reaching 2 years of age. I hope to spend a lot of time with her as a mentor and as a member of her very close family. And you'll be in good hands. It has been a very emotional trip in the last 6 months or so when the prospect of retirement was kind of looming on the horizon. It has been 40 years of trying to do good for people. I had no expectations that I would have a doctor crying or his patients crying about stopping some of this. I have loved them, they have loved me, and we have been blessed. I think I will miss most the patient contact, the ability to talk to people, to see a lot of people in my day. I'll miss the challenge of being able to sort out their problems and being able to fix or manage what their difficulties are. And I'm hoping that even though I am not actively practicing, that I can now participate in the functions of the community that are not necessarily medicine.
I want to thank Dr. Crawford for a couple things. One, obviously, is he brought great value to us in bringing his private practice to Boys Town. But even more than that, I want to thank him for great care. He really cared for his patients, not just provided ENT services, but he cared for his patients, and I really want to thank him for that.
I would like to be remembered as someone who cares, who was easy to talk to, a friend. I would like to have done good work as well as made right decisions, whether they were surgical or otherwise. I would hope that I would be a good role model for a physician, a father, a member of the community. The staff at Boys Town and the General Hospital have been wonderful. The ORs, the outpatient people have just been absolutely terrific. I want to thank the patients. There's a lot of different ways of looking at this picture, but there is no one finer than a person who trusts you, brings you their body, or maybe the body of their children, and say, here, we have a problem, let's see what we can do to fix it. They have thanked me many a time, and I would like very much to thank them always, but especially now.